Do you frequently feel tired, even after a full night's sleep? Or have you noticed small lumps in your neck, under your arms, or in your groin that don't hurt but just won't go away? These could be signs your body is fighting something quietly, like small lymphocytic lymphoma, SLL. SLL is a kind of slow-growing cancer that affects small white blood cells called lymphocytes, which are a part of your immune system. Think of lymphocytes as the security guards of your body. In SLL, these guards start multiplying too much and don't die when they should. They pile up in lymph nodes, bone marrow, and spleen, making those areas swell. It's like having too many security guards, standing around and blocking the hallways instead of working. The good news, it usually grows slowly. So many people live with it for years without serious issues. What causes your body to create too many of these security guard cells? Well, scientists don't know of one single cause, but they believe it's mostly due to small changes, called mutations, in the DNA of lymphocytes. Imagine if a guard's instruction manual gets a typo. Suddenly, the guard refuses to retire even when tired. That's what happens in SLL. These DNA changes seem to happen as we age, which is why SLL mostly affects people over 50. It's not contagious, you can't catch it from someone else. Also, it's not caused by lifestyle choices like diet or exercise. But if someone in your family has had a blood cancer, your risk might be a bit higher. It's like inheriting a slightly faulty instruction manual from your parents. Now, how do you know if you might have SLL? Many people don't feel sick at all at first. It's often found during a regular checkup. But some might notice painless lumps in the neck, underarms, or groin, like a marble under the skin that doesn't hurt when you touch it. Others feel tired all the time, night sweats, like soaking your pajamas for no reason, or lose weight without trying, say, dropping a clothing size even if you didn't change your habits. Some might get frequent infections because, even though there are lots of lymphocytes, they're not working well. Think of having 100 broken security cameras, looks secure, but nothing actually works. Your body keeps getting breached by colds or flu. So what happens if your doctor suspects SLL? First, they'll likely do a physical exam and feel your lymph nodes. Then, they might take a small piece of the swollen node. A biopsy, like sending a suspicious machine part to the lab to check why it's not working. Blood tests and scans, like CT or PET, help see how far the cells have spread. Once confirmed, treatment depends on how you're feeling. If you have no symptoms, doctors may say, let's watch and wait, kind of like keeping an eye on a slow leaking tire instead of fixing it right away. If you do need treatment, it may include medicines that help your body kill the bad cells, like targeted drugs. For example, ibrutinib or immunotherapy, which is like upgrading your security team with smarter guards. In some cases, chemotherapy is used, but it's not always needed right away. Can you prevent SLL? Right now, there's no sure way to stop it because it's not linked to things like smoking or diet. Since it's not caused by germs, you can't avoid it like the flu. But you can support your body by staying healthy, eating balanced meals, exercising, avoiding harmful chemicals, and going for regular checkups. It's like keeping your house well-maintained, so if any small problem appears, you catch it early. If you're over 50 or have a family history of blood cancers, talking to your doctor about routine blood work might help detect changes early, even before symptoms show up. The good news is scientists are learning more every year. Recent advances include new drugs that target specific mistakes in cancer cells, like fixing just the broken circuit instead of replacing the whole machine. For example, drugs like acalabrutinib and venetoclax are now used to block signals that tell bad cells to survive too long. Researchers are also testing combinations of these drugs to work better and with fewer side effects. Another exciting area is minimal residual disease testing, a super sensitive test that can find even one bad cell among a million. It's like using a microscope to make sure your house is truly pest-free, after an exterminator visit. This helps doctors know if treatment worked deeply and when it might be safe to stop. Clinical trials are ongoing, offering hope for even better, personalized treatments in the future.